Hi guys, thank you very much for joining us. Welcome back. Now we are all so happy to be here. Now for those of you who's joining us in this webinar, this is the first series that we are doing, and of course the first episode. We hope we'll be able to do this for a very long time. Now for those of you who are here, welcome, and of course this is brought to you by iXchange, a webinar series, Get Your Health on the Right Track. So you've guessed it, whatever we're going to talk about today is all going to be about your health. Now, so when it comes to health, there's so many things to talk about, right? So we've decided, we sat down, we thought through what could possibly be the topic that everyone is most interested in. So we came to the conclusion that for today's episode, we'll be talking on 3 topics. Now, the first topic, I have no idea if you guys can guess it, but it's all about back pain. Now, hear me out. We spend 1/3 of our lives sleeping in our bed, right? During COVID, a lot of us spend a large amount of time on the chairs. So you guys can understand where I'm coming from. Even myself, when I'm at home, I'm always on the chair, and as a result, I develop some pain, some swelling here and there. So back pain is going to be a huge problem for a lot of us, including me. So the first talk, we're going to be having our lovely presenter to talk about that. Now, moving on, we're going to talk about what everyone has always been interested in, and that's in losing weight using intermittent fasting. But of course, IF is not just all about weight loss. It is also about having a very clear mind, having very regulated blood sugars, and that's where the second presenter will be touching on that. Now, the third topic, we always believe you are what you eat. Food equals health. So today we'll be talking about the third topic from a TCM's perspective. So ladies and gentlemen, we're gonna start right now by having the first presenter to join us. Please join me. We're gonna welcome our senior physiotherapist from Mount Elizabeth Hospital, the lovely Miss Candice. Yo, hi.
Hi,
hello.
James. Hi. Yo. Hi. Hi. Hi everyone, good afternoon to you. I'm Candice. So yes, thank you so much, James. So it's my greatest pleasure to be here with all of you online. Can't really see all 200 plus of you here, but yeah, I'm very honored to be sharing a little bit more about the information on the science of sitting, a huge topic which will take more than 20 minutes, but I'll try to shrink it to a more succinct presentation today.
Thank you so much.
Yeah, that you will derive some take-home messages with you that will be beneficial for your be it back health, neck health, or even shoulder and all different joints on your body lah. Yeah.
I'm actually starting to feel it.
Yeah. So hear me out later, okay?
Okay.
Some of the tips will be useful for you. Okay, so for today's presentation, let's get on to the topic for today. So we do have some information that we are going to share with you. The contents of the slide for today, right? We'll be talking about the adverse effects of sitting, okay? And then follow up, we'll be looking at the importance of work ergonomics, as well as having a little bit of a demonstration with some kind of a self-evaluation on how is my workstation like, yeah? And then we're going to end off that session quite pretty soon, and then carrying on with the dietitian with us, all right? Yeah. So first thing first, there's going to be 3 questions polling to derive some information from our crowd now. So for the first polling question.
Oh, this is very important as well. Now, please join us in all the polling questions, because this will give us a very good indication of how you're feeling on this topic. Now, apart from that, now for the entire webinar series today, please feel free to ask questions via the Q&A box that you have in your webinar platform. So please do ask questions, because at the end of the day, we'll be picking up some questions and be getting these experts to help us answer them. Now, before we move on to the poll, can I just ask you, during this COVID period, or even before and after that, the kind of back pain that people are having, is it a common thing you see as a physiotherapist?
Most definitely so.
And you really think it's because of too much sitting down?
I would say it's really a case-dependent kind of situation. It can most likely be related to sitting.
Okay.
I would say most of the time, if you're spending your day,
Entire
2/3 of
day,
it,
right?
yes,
Sitting down.
correct. That would definitely contribute, will be one of the contributing factors because of that stationary position. And then with the lack of blood circulation and stuff, it won't just be a back pain situation.
And everything is on Zoom now, right?
Exactly.
So all of you who's watching it, all of you are sitting down, right?
Yes.
I don't think there's anyone who's standing up. Right, so we're going to move on with the presentation.
Yes.
And we're going to see some of the gems that you will present to us today.
Okay.
All right, let's go.
Right. So we'll have the first polling question with us, I guess, today.
The
will be showing
polling
up.
question, so all you have to do really is to just click on what you see on screen, and I'll be just asking the questions. So
Correct.
maybe let's shoot.
The first question will be asking from my audience here, right? How frequent do you take breaks from sitting at work? So be very honest with yourself. I'm not sure about James whether he's
It's coming in. Look,
Oh.
yeah, the results are coming in.
right. Wow. Quick,
Every
quick,
2
quick
hours,
one.
my goodness.
Oh, yes.
Wow.
Wow. That's quite. Wow, nobody clicks on every 10 minutes. Okay.
I mean,
That's
unless
a
you
bit
have
too
those smart
fidgety,
watches to remind
like
you. Huh?
standing, sitting, yeah. Okay. That'll be every 10 minutes. Yeah. Okay. So majority of you guys are actually sitting every 60 minutes, every hour. That's pretty good. That's okay. Having a movement with every 45 minutes to 60 minutes is a good gauge. Yeah. How about the next question? I just want to find out from my good audience here, what activities do you do during your break time? So are you like standing, marching on the spot, or would you rather go to the fridge, keep opening, closing your fridge, open and closing the fridge to grab a snack or drink, or do some random stretches, or just watch Netflix lah?
Sit and watch Netflix lah.
What's the recent documentary or what? Yeah. Tinder
Swindler.
Yeah. I watched that. Not bad. Yeah. So let's see.
The results are
polling.
interesting, you know. See, Candice?
Looking at this is the peak time now. Most responses are coming in. So most of them,
Get a drink or something.
very
or something.
honest audience.
Hey,
yeah.
that's true. You know, every time I stand up from my chair, it's because I want to open my fridge. I want to see what's inside. Hey, you know what?
I think I'll be
anything
doing
I
that.
snack on.
Correct.
Interesting.
Yeah. What's the next? Yeah. Next thing or next snack to take. So okay. Activities, most of you are getting a snack or drink, yeah. So it seems like pretty much what Singaporeans would do, huh? Okay. Next question. Prolonged sitting is a question just to test out whether.
So easy, this one.
Yeah lah. True or false? Prolonged sitting may lead to leg swelling. True or false?
Come on, guys, you know this.
A bit shy then you put unsure, not too sure lah. Huh?
Which is valid, huh? Because you never know. Yeah, you never know. It's pretty subjective.
Exactly. So majority of us here actually wrote true, and we've got a very smart audience here.
Very smart audience.
Correct.
I agree.
The answer is correct because a lot of studies have actually shown that the lack of movement or activity can cause blood to pool on your legs, and that can eventually lead to swelling. Maybe some of you actually experienced it yourself as you're sitting down watching this webinar series today. Yeah. Okay, so we're going on to the next few slides now, sharing some facts with you first and foremost. You might be able to even derive some of this information from the internet. So this fact first out on the screen, World Health Organization has actually estimated about 3.2 million people worldwide suffer early death because of their sedentary behavior. All right, and unfortunately, office workers are predisposed to a high chance of leading a sedentary lifestyle. Yeah, okay, unfortunately, because this is part of your life because of this fast-paced society. Everything is going with technology. You are forced to sit down to go through this paperless kind of workflow. Yeah, so all this can result in prolonged sitting. Yeah, okay, so facts are facts. We need to also acknowledge that there are also all these adverse effects of sitting, as what during the poll most of you would understand. Prolonged sitting can lead to leg swelling. Not just that, there's also in the blue the box, right? Cardiometabolic diseases such as diabetes type 2, even coronary artery diseases, obesity, and high cholesterol, high triglyceride levels. When you go to the polyclinic and do your blood test check, these are all the important profiles that we need to know. And then the second table over there in yellow, musculoskeletal disease. So you might be looking at this strange word. What is sarcopenia? Yeah? Now, sarcopenia is just a technical term referring to muscle loss, muscle mass loss. Yeah. So what happens as we increase the duration of sitting? For every hour, there's a 33% chance of having this sarcopenia accelerated. Yeah? So losing your muscle mass as you prolong your duration of sitting. And of course, as what James has reiterated again and again, back pain, neck pain, shoulder pain, any kind of discomfort around your body. And then third thing on the screen in the red box would be cognitive, referring to things that you might be experiencing as you're spending more time sitting would be brain fog. You might feel a little bit of a mental fatigue. You find that your processing speed is getting a bit slower. You feel like you need to walk around a little bit more because you feel your productivity, your focus is reducing. Those are the signs and symptoms of your adverse effects of sitting.
Well, so many problems related with sitting down.
Yeah,
but it's so
yeah.
simple, you just sit down.
Exactly.
But I want to sit, leh. I mean, it's so comfortable. Why wouldn't I not sit?
Exactly. Sitting is just part of the process that we want to accelerate efficiency. So nowadays people are getting more of those standing desks and all that. So I applaud you for that effort.
Is that good?
We will bring on more discussion when the Q&A starts later on. I'm sure most of you will be firing up some questions later on related to that. So, importance of ergonomics. Why do we need to evaluate sitting postures and all that? So let's look at the definition of what ergonomics. So ergonomics is looking at the signs of your workplace health, your signs of sitting, your signs of fitting your workplace to make sure that you have a reduce in your prevalence of injuries and stresses on your joints. And most importantly, it connects you with understanding the different aspects of your physical environment so that you understand better, you place less stress on your muscles, your joints. So there is you increase the longevity of your ability to last longer in your workplace. And that is why it is important. It reduces work-related stress and strains. So moving on, now is the part where we are going to look at something more exciting. Yeah, I'm going to ask yourself 5 major aspects or 5 domains of your workplace. You're going to do a self-evaluation. All of you here sitting down.
Okay, so let's be serious. This one you have to go through.
Exactly.
Evaluation. How healthy is your sitting life, right?
Correct.
Okay, let's take a look.
That's right. So there's 5 domains we're going to look at. First thing first, right, your workstation evaluation. All of you can start looking at your chair, first of all. I'm not going to look at how expensive your chair is and all that. So first thing is your chair well adjusted for support and comfort? Are you sitting with your back well supported against the back of the chair, or do you have a huge gap like what I'm having now, okay? All right, which is not good in the long run. All right, if you're going to sit for a good half an hour or 45 minutes, that's not good. Or are you well comfortable seated backwards? Okay, with the back against the
We
back
hope you are. We hope you are.
Exactly. Okay, and next question to ask yourself, the previous slide is, are your feet well supported on the floor? So if your legs are a bit short, you might even need to get a stool. Correct. So some of us are like vertically challenged, like myself, sometimes I need a stool. Okay, so do you have that support? Next question is looking at your keyboard and your mouse. Okay, so is your keyboard, when you're using them, are your shoulders well relaxed? Or are you shrugging up and feeling like you are building a lot of tension as time passes by? Okay, so are your shoulders actually relaxed? Your neck relaxed while you're using the keyboard or the mouse? That's the question to ask yourself. Second question, are your elbows well beside you, okay, at your side? Or are you trying to overreach too much forwards? That is not a good sign, okay, because that will strain your shoulder joint. Third question to ask is the keyboard or just right next to at your elbow height? Okay, that's the third question. And then moving on, whether the mouse, if people are still using those mouse with a wire, you feel that you need to reach forward, is it just next to you? And then last question, are your wrists straight, or as you can see in the picture, are your wrists slightly like senge, like shifted to one side, deviated to one side or inside? So you need to ensure that it's pretty neutral when using the mouse. All right, so that's the second one. And then the third domain, everyone check your posture right now. Are you trying to hunch forward to look at me, or are you well seated backwards with your eyes behind you? Is your head upright and straight? So don't be in the picture where there's a cross sign, don't be hunching forward to look at me, okay? And is your monitor placed directly in front, or is it angulated this way? So those are questions to ask yourself, and whether your chair is able to swivel accordingly. And then third question is whether the viewing distance is just nice. About 30 cm, 40 cm will be good. Okay, moving to the second last evaluation, the domain will be looking at your work environment. So do you have enough leg clearance to stretch out your legs when you're at the desk, and then do you have frequently used items close to you? And that's the fourth one. And last but not least, the fifth one we'll be looking at, next slide, your work habits. So everyone, yes.
Everything matters, huh?
Correct.
So many things, yeah.
Correct. So this is looking at, am I stretching enough? So for those of you during the polling question, you've answered, you stretch you take frequent breaks, like every 45 minutes. So I'm assuming that you do take this kind of short micro breaks through the day, and you're trying to reduce the second question, reducing your repetitive typing at your workplace, at your work desk. And then third thing, third pointer here, also very important, is your phone, be it at the desk or in standing, in your day-to-day activities, is your phone handling posture acceptable?
What? Phone handling posture?
Interesting question, right?
Yeah, what's that?
So a lot of people, and when I see on the MRT train, right, they will do something like this. They'll be craning their neck forwards this way, looking
wrong.
this way.
See, all our staff are all doing it wrongly.
So you must sit back and evaluate. That's the whole purpose of this
how do you use a phone?
section.
So how should you use a phone?
So ensure that most of the time your chin is not protracted forwards too much. Keep your chin relatively in, and make sure that you're not lifting your phone so high this way when your shoulders are so tensed up. Try to relax.
Don't do that.
Exactly. Don't do this. This is a negative demonstration.
Negative demonstration. Positive. I look kind of weird, but it's okay. It's right.
You'll get used to it soon. Okay? Yeah. So let's look at the actual demonstration now. I've been sitting for quite some time, James. So maybe, maybe I feel that I need to demonstrate some exercise.
Let's demonstrate, man.
Okay.
So for those of us watching this, if you're sitting down for the past 1 hour or so, come on, let's do some light exercises together.
So
let's relax.
We'll just go through about 2 or 3 exercises which are critical for the shoulder area and the neck area. So,
shoulder? Okay, sorry.
Point number 1, you must first of all find a wall.
Wall.
So James shall be my wall today,
I'll be your wall?
So turn around, please. Find a wall if you can. Place your arm against the wall. And then what's next? Because I don't have a wall nearby, so I have to borrow James. He's a very kind volunteer here. So what you do next is...
choice,
So next, we have to place our arm here, and then we try to start rotating our chest wall away from the wall. So this will act as a pivoting point. So when you do this, you start to feel a stretch on the front of your chest wall. That's the most beneficial stretch for people who tend to hunch quite a lot forwards. And then the next common and good stretch will be for the neck area, the upper trapezius.
It tends to get this.
Correct, a lot of tightness and tension here. So I need to tilt your head sideways, ear towards the shoulder. Don't bring your shoulder towards the ear. So bring your ear towards the shoulder. All right, and then bring your arm across your head so that it touches the left ear.
Oh,
in
yes,
my
I
case,
feel that. Yeah, over
then
here.
Start to feel a pulling tension. You can even place your arm at the back of your buttocks to feel a stretch. So that's the second one that's good. All right, and then the third one, on the picture here, you can see that there are some good ones as well. So you can clasp your hands at the back of your buttocks this way. So about 10 to 20 seconds this way. So everyone can join us here as well,
some pectoral stretch.
Don't just sit there and watch
us. What have you got to lose?
Or even stretching outwards this way. Simple ones. And the last 2 pictures that you'll see subsequently are all in standing already. So you can use your wall, do some quadriceps stretch.
Oh, nice. The
this
wall also
way,
can do it.
To stretch out the front of your hips, because when you sit for too long, the front of your hips gets tight as well. So stretching out this way, as you can see on the picture.
How often should we do this? Like, in a day, how many times?
Very good question. A lot of my patients and clients will also ask this question. I would recommend on a case-by-case basis, if you do have pain, please come and see us at the clinic for a good assessment, to make sure that you do the stretches correctly if you are in pain. If not, you are not in too much of a discomfort, you can do them on maybe 2 times a day, 3 times a day, or every 40, every hour or so. So do connect with us. There is this corporate partner quotation, Ouch My Back. So you can get your first consultation at that pricing. Or alternatively, you can call in the clinic for more enquiries or connect with me through the email written. Candice _ Thank you so much.
So here we go, Senior Physiotherapist, Mount Elizabeth Hospital, Miss Candice Yeo. Thank you very much for joining us. Thank you.
Thank you. See you around.
All right, now that was such a lovely topic to talk about. Now, the second one that we're going to bring you to is going to be in the world of intermittent fasting. Now, I hear that Andy Lau practices the 16-8, which means to say he doesn't eat for 16 hours, he only eats for 8 hours. So, intermittent fasting, how is it supposed to help us be a better person? How does it help us lose weight, have a clearer mind? So, today, folks, we're very proud to bring you our senior dietitian from Gleneagles Hospital, Miss Hui Mei, to share with us more.
Hello, good afternoon, everyone. Hi, thanks for tuning in. My name is Hui Mei. I'm the dietitian in Gleneagles Hospital. So today, I'll be sharing some tips on intermittent fasting, how to do it more effectively, and also what are the evidence out there. Okay, so before I go into my sharing, so firstly, I would like to have a poll question. Okay, so would like to check as in like how many of you there actually in practicing on intermittent fasting, and if you do, which method that you all try? Okay, so the first one is actually 5-2 diet, which is 2 days cutting down your caloric intake, and then the 5 days is eating as usual. Time restricted eating, as what James shared just now, and allow 16 hours of fasting, 8 hours of eating, or 10 hours of 16 hours of another method is actually 14 hours of fasting and then 10 hours of eating. C, complete alternate day fasting. It's like 2 days or 3 days a week that you don't eat at all, very limited calorie intake, and the rest of the days will eat as usual. Or you have not tried any intermittent fasting before. Okay, so you can actually put in your answer, and I will share the result in a short while. Okay. All right. So the result is out. Yes. Okay. So based on the result is that right, majority actually have not tried intermittent fasting before. Yeah. So for those that who have tried, yes, I mean that you're actually like Andy Lau also. So time restricted eating is actually the most famous among the intermittent fasting. Okay. So let's see whether is that actually the situation out there. Okay. Later on, I will share in my slides. Okay, so today what I'll be sharing is actually talking about dietary approach for weight loss and what is this intermittent fasting, how to do it effectively, and of course, I mean that I will actually share about behavioral modification. Okay, so before we go into the topic, let's look at the prevalence of obesity and overweight in Singapore. So you can see this is actually a national health survey done for every 3 years once. So if let's say we can focus on the 2020 result, the latest result, we notice is that right, this obesity and overweight become a growing problem. If you were to look into it, the green color line, so it basically tells us it's like 1 in 11 Singaporean is actually having this obesity issue. And for overweight, you can see it's like 3 in 10 are having overweight issue. Yeah, so it's actually every year has been increasing. Yeah, so after looking into the graph, the chart, we know that the prevalence is high. So we need to see what are which dietary approach is the best evidence to help for weight loss. Okay, so first of all, what we need to understand is that when does this weight loss occur? So we have to back to the basic caloric balance concept. Okay, so if let's say your intake basically is like what we eat. Okay, the food that we put into our stomach and to our body, this is actually caloric intake. So for caloric output is actually the physical activity that we do, the basic metabolic rate, and also the energy that we use for digestion and all that. So if let's say your intake is equal to your output, basically you are going to maintain your weight. So in order to create for weight loss, right, what we need to do is actually we need to create energy deficit, which is intake less than output. Okay, so based on the Academy of Nutrition and Dietetics in America, so we can see this is actually the evidence, and it's a strong evidence to say that individualized diet should be prescribed for those who want to bring down their weight. So including patients' preference and health status to achieve and maintain nutrient adequacy and reduce calorie intake based on the following reduction strategies. So you can see that for female, so it's actually we keep about 1,002 to 1,005 caloric a day. For male, we keep about 1,005 to 1,008 caloric per day. Or we, as in like from dietitian, we will assess your total calorie intake, how much that you're eating, and we deduct 500 to 750 calorie per day. Or another method we can use is that one of the evidence-based diet that restricts certain food types in order to create energy deficits. So this one I will share later. So looking into that, right, you can see that what we are this a few strategies, right, are more we call as continuous energy restriction. So this is actually what we always been practicing. Yes, and also it's actually the main form of restriction via dietary means. So for this continuous energy restriction is like a daily basis, right? So, and we can see that the result is effective. For those that who are doing it, the weight loss is actually quite significant. But there are a lot of that, but a lot of people actually think that it is too rigid. Yeah, because you every day have to restrict yourself to a certain amount of calorie. That's why that people find it difficult to maintain. Hence, this intermittent fasting actually comes in. Yeah, so has gained popularity in the last decade. And I mean that is also research do support that intermittent fasting achieve weight loss. But something to take note is that, right, it doesn't provide superior management in comparison with the continuous energy restriction. Okay, so now we go into this intermittent fasting, right? What is it and how many types of that? So if you were to look into that, right, there are actually in total, there are many types of intermittent fasting. So we have a complete alternate day fasting as what I shared just now. It's like they are the fasting days is basically no energy containing foods and beverages consumed, and another then you actually a few days it will be eating days whereby you eat as usual what you normally take. Okay, so for the second type is modified fasting regimens. So this is actually the 5-2 diet that I shared just now. So on the 2 days of fasting, so you'll be consuming 20 to 25% of energy needs, of your requirement. So the rest of the 5 days you will actually eat as like based on your requirement. Okay, so there's actually the another third type is actually the time restricted feeding. So these protocols allows people to consume like the energy within a few hours, as what we shared just now. It can be actually 8 hours or it can be 10 hours. Okay, so the rest of the fasting, right, is more to like a religious fasting. So there are many types of that. Okay, so among these three, let's look at this complete fasting, modified fasting, and time restricted fasting. Okay, so which one is actually the most common one? Yes. Which one is the most common one? Okay, just a second. Yes, you're right. Time restricted eating is actually the most people doing it. The reason is because you already fast while you sleep, right? Yeah, so that's why there's actually don't have to take extra effort on like you don't have to eat the whole day or what. And it can be repeated as often as a person like, and even done once or twice a week. Yeah, so it based on personal preference. Okay, so let's look into the comparison between this intermittent fasting and um, yeah. So intermittent fasting and continuous energy restriction, right? So based on the evidence out there. Okay, so intermittent fasting, right, is actually support for short-term weight loss. Yeah, so because there are still lack of evidence or research to look into the long-term outcome. Whereas for continuous energy restriction, you can actually know that once you do it and you do it for sustainable for a long time, you will see the weight loss. Okay, and for intermittent fasting, there are studies actually show improvement in disease indicators like insulin resistance, blood pressure, but the study is actually again is actually quite short term. Yeah. So, but whereas for continuous energy restriction, right, we can see the improvement in the disease indicators. But one thing to highlight about this intermittent fasting is that, right, it is not for everyone. Yeah, especially for those that who having type 1 diabetes, for example, or maybe those on diabetes that on oral glucose lowering agent or insulin injection, because you have to eat according to your insulin injection timing. So you cannot be actually like saying you take the medication or you inject and you don't eat. That will be actually impose a very high risk on hypoglycemia. Yeah. Okay. So we have to actually take note that there are certain side effects also when you're actually practicing on intermittent fasting. Like for example, hunger, because on the time that you're not eating, you experience this, fatigue, insomnia, headache, and importantly, and one thing that we always been hearing is actually the irritable, because it's like you when you're hungry, it's a hanger, right? So hungry plus angry. Yeah. So then this is actually it will reduce the ability to concentrate. Now, of course, for continuous energy restriction, there are certain side effects as well, like for example, hunger, because you continuously control your calorie intake. So let's do a comparison between safety concern. So for intermittent fasting, we're not sure whether how is it going to be for long-term use because we don't have the result yet. Yeah, but for continuous energy restriction, the safety concern is that if you prolong intake lower than 1002 caloric, that it will somehow affect a bit of the metabolism of the body. So that's why that we actually need to monitor closely in terms of like how you do it for your diet control. Okay, so how to do it effectively? That's actually important to know, right? So what is actually shown in the slide here? So this is actually a table to summarize the types of diet intervention that is considered effective and supportive for weight loss. So the first column, this is actually based on a good study and it's actually a high level study to show that these few method, the and diet control will help for weight loss as what I actually shown here. So as what y'all can see is actually decreasing sugar, the beverages intake, portion control, low caloric diet, or you're practicing on meal replacement, low carb diet, high protein with energy restriction diet, or dash diet with energy restriction, or Mediterranean diet. Yeah. So you can see from these few boxes, right? What are the similarities? So you can see that the similarities is that, right, they're all talking about caloric intake. Yeah, so ultimately, total caloric intake matters. Okay, so if you look into the second last column, right, on the table, so timing of eating, right, is actually it is actually part of the lacking investigation. So it doesn't mean it is not effective, but it's just that it is lacking of investigation. Okay, so we'd like to see if let's say this is your usual intake, right? So if your usual intake, like for example, breakfast, you have like a set of bread toast, toast bread with coffee and two soft-boiled egg, and then lunchtime you actually have char kway teow, for example, and then you have bubble tea with let's say 50% sugar. Okay, so then dinner, so you have like a chap chai peng with curry sauce, curry gravy with chicken, vegetables, tofu. Yeah, and before you sleep, then you go and have your maybe some dessert when you watch TV because it's like after a long day of sitting, right? So it's like going to visit the fridge and take some cookies and all that. So if this one and you're practicing on intermittent fasting, let's say, and you squeeze everything into that 8 hours time, do you think that you will see some weight loss? Yeah, you probably won't see because your total caloric intake, right, will be actually still the same if we're to compare like if let's you doing like a daily, you don't restrict your timing of eating. Okay, let's see another example. If this is your usual diet and you change your diet to 8 hours, so of course the last eating, which is the cookies or dessert, right, it doesn't fit into that 8 hours anymore. So will you see weight loss? Yeah, Bob, you will actually see, but is still not significant. The reason is because, right, the caloric intake overall is actually still high, and the food choices, right, are mainly still high in fat and sugar because of the bubble tea, you can see. Okay, so give example C. So this is actually your usual diet, right? And you change your choices. So you restrict your your eating to 8 hours, but you make changes to your diet. For example, breakfast you keep as your toast bread. Then lunchtime, instead of the char kway teow, you change to something noodle soup. From here, just the change of these choices, but you still finish full share, right? You'll be able to cut down your calorie intake to almost about 300 calories just by these changes. Okay, and then change your bubble tea, which 50% sugar, about 200 plus caloric, to 60 calories orange. So from here, you manage to cut down another 100 plus calories already. And dinner, instead of like the rice with a lot of gravies and the fried stuff, right, you change to brown rice, or you change to white rice also can. But then you have full share of you have vegetables, you have meat or chicken, but they are mostly non-fried item, and you can still pair with a fruit. The calories will be still lower than the plate of the rice that's shown on the left side. So this one, right, you can say that you restrict the timing, at the same time you control your caloric. This will definitely help for bringing down the weight. Okay, so the recommendations for practice at the moment. So for in practice for intermittent fasting is that, right, we can see a short time frames, a short time a result would definitely be very sure, but we are still unclear whether how in long term how sustainability it is. Okay, and at the moment we still lack of scientific evidence regarding an ideal plan for intermittent fasting, such as the number of weekly fasting days, whether 2 days is better or 3 days is better, duration of each fasting, these 10 hours or 14 hours, right? Not so sure. We still lack of the evidence, extent of caloric restrictions, and how you eat on the non-fasting days. So we still need more in result on this. Okay, so if you want to practice on intermittent fasting, that's absolutely okay, but you have to make sure that you have to get enough nutrition, you have to get enough hydration and fiber, and also in terms of like hunger wise, right, you need to learn how to cope with hunger. So this one actually bring me to another topic of mine, which is actually behavior modification. So these three components, right? So it's actually not very not familiar, but this is actually the important three components when we talk about weight loss journey. So diet that I mentioned just now, exercise just now, Miss Candice has already mentioned. So it helps for actually you I mean when you actually stand up, right? Don't go to the fridge and then take food, right? So rightfully is actually the best is actually do some exercise at the time to actually increase your energy burning. And lastly, the behavioral education is also very important. So as what I mentioned, you need to deal with it, deal with the hunger. So how can we do it? Okay, so importantly, so when you actually go for the diet control, these are the few things that must make sure. Enjoy your meals, eat slowly. So we recommend is actually about 15 to 20 minutes of eating for each meal. That is actually helping you to understand the fullness so that you will not overeat. And importantly, avoid distractions. Don't watch Netflix, don't watch YouTube when you eat, because when you watch TV or when you watch movie when you eat, right, which one that you all will be focusing on? Of course will be actually the movie, right? So then in this case, right, you won't be able to understand how full you are. So you will just continue to eat and eat until you finish the whole packet, and after finish the movie and say, oh, I finished the whole packet, I've eaten 500 caloric already. So then in this case, right, it really at risk of putting on weight. And one more important thing to note is that, right, don't shop, avoid shopping on the empty stomach. Don't go and shop on the fasting hours lah, on the all the fasting day, because right, when you see everything also very nice, right, so you will just take some and take everything. So in the end, right, the cart will be full of food already, that it will be a bit risky. So put a list down, or shop on the day that you really have a full meal. Okay, so these are actually important point, is that right? Because when we see patient or we see client in the clinic, right? So 50% or more than 50% of them will just tell me that, oh, they comply with the diet control. They already tried various ways to control their calorie, but it's just that they don't see the result. So they start to report to me what they eat every day, and it looks fine, everything looks fine. Then suddenly they'll just mention that, oh, I eat when I'm stressed, or I eat when I'm bored, okay, or I eat when I'm working. Yeah, so it's like when you have a lot of meeting, you're just like snack and snack. So then in this case, this is what we call as the mental hunger, you see. So it's like a emotional eating. Yeah, so we have to highlight this to them, as in like, because this is one of the behavior that people may not aware of it. Or another example, when I have had enough, the day I just dug into a cafe, sat down and ordered a cheesecake and wolf it down between my errand. Yeah, so you can see that they actually like or report all the thing nicely, right? But they may not be aware that these are things that additional they are doing. Yeah. Another example, I can't exercise until I get to 75 kg, or else my back and knees will hurt. But I want to lose weight now without exercising now, so I can go back to the gym. What do y'all think about this statement? Yeah, so it is actually that is unrealistic, right? So we need to actually tell them, highlight to them that these are the few things that you all need to take note, mates, subconsciously or unconsciously, that they are doing it. Okay, so the conclusion of this of mine for regarding this intermittent fasting is that, does it work? I would say is that, right, a lot of people also claim that diets don't work, but in fact, all diet work. The predictive factor of success is how long and how well you stick on it. So sustainability is actually the key of when we talk about weight loss journey. Okay. All right, so here comes to an at the end of my talk. My talk. So you all can actually look for, if let's say you're interested, can look for our dietetic services in IHH hospitals, but we also available in Gleneagles Hospital as well. So if you are interested, you can call to the number that is stated in the slide, or email us. So for our corporate clients partners, you can quote, "I wanna be lean" when you book your first consultation with us. Yeah. So, but if let's say you don't have any medical history, medical background, so self-referral is accepted. But if you do have other medical problems like high cholesterol, blood pressure, diabetes, right, a doctor's referral is required. Okay. So, thank you.
Thank you very much, Hui Mei. Well, ladies and gentlemen, they used to say, if Jesus, Muhammad, and Buddha can agree on one thing, that's fasting. Now, for those of you who haven't tried it yet, well, please go ahead and try it. And of course, not everyone may be suitable for this. Again, please consult your dietitian or your GP, your doctor, your specialist, or you can even consult Ms. Hui Mei directly for more information if you're suitable. And now, other people have always mentioned as well, you are what you eat. Ladies and gentlemen, for the last speaker today, we're going to bring you into the world of TCM. And of course, as we all know, physical ailments can arise from emotions, lifestyle, or dietary habits. Today, we're proud to have physician Anton, our lead TCM physician from Parkway, Shenton. Ladies and gentlemen, let's have her to join us.
Hello everyone, I'm Ann TXT and happy to meet all of you here and hope you are doing well for the past few months as our world starts to open up. I want to thank our brand marketing team, especially Michelle Lim, for organizing this seminar and inviting me to share important TCM concepts, specifically focused on food wellness for all of you here to help maintain your well-being amidst these challenging times. Okay, so here are the topics covered today. You understand what TCM health and wellness is, how to stay healthy the TCM way, how food is digested, how emotions affect digestion, and how food can be classified into different categories the TCM way. Okay, so let's start by first understanding what TCM is all about and how it can benefit your health. So traditional Chinese medicine, or TCM in short form, is widely regarded as a complementary therapy to contemporary medicine. So from the phrase traditional Chinese medicine, we understand that this is a holistic way of healing originated from the Chinese culture and has existed for thousands of years. So TCM sees the human body as an organic whole in which all constituent parts are structurally inseparable, functionally coordinative and interactive, and pathologically inter-influencing. It also recognizes that the human species is closely related with natural and social environments, and that we maintain our normal life activity by actively adapting to and thereby transforming nature. So therefore, wellness is about balance. When we are sick, our bodies have the innate ability to rebalance itself over time to maintain the natural state of health. Hence, everyone can learn more about, understand, and use TCM principles no matter where we are in our personal health journey now. So let's find out what are the important definitions in TCM health. Okay. The definition of health is that it's a natural, harmonious state of a human being. A healthy person has smooth overall energy, total qi flow, with all four internal energies of moving qi, blood, yin and yang energies at their optimum level. The body can maintain wellness by nourishing and balancing itself consistently, and therefore, any physical discomfort or symptoms disappear in a very short time. Meanwhile, the definition of illness is a discordant state of the body whereby the combination of internal and external factors, including the six pathogens, imbalanced diet, too much or too little physical activity, etc., these are consistently imbalanced and therefore unable to maintain its natural state of well-being, leading to physical discomfort and symptoms appear over a long period of time. And last but not least, definition of subhealth is the borderline state, between being healthy and being ill. Physical discomfort and symptoms are less obvious than illness, but there's an obvious decrease in overall energy level. So how do we stay healthy the TCM way? First, we now understand what health is. It is actually a state. And if states are fluid and can be changed, right? And we also need to understand the six pathogens and four internal energies, as our current body constitution is made up of the combination of excess pathogens and stagnation or deficiencies of our internal energies. Okay? So today our focus is to understand how daily foods are digested. Do they purge the pathogens or do they nourish the internal energies? So let's start with the first pathogen. This is the wind. So it is always moving fast everywhere. It opens the pores on our skin, and has the ability to shift other pathogens around the body. Its associated season is spring. Meanwhile, related symptoms are headache, cold sweat, dizziness, and seizures. Next up, we have cold. Means constant lower temperatures than what our human body can withstand for long periods of time. And it occurs and stays in localized areas of the body. Associated season is winter. Meanwhile, the related symptoms are coldness in specific body parts, decreased circulation of various systems like the blood flow and lymph nodes, and strong pulling tension pain in muscles and tendons. So what is dampness? This next pathogen, it is a feeling of heaviness and sluggishness. It is sticky and can be smelly like the mold on the wall. It can spread around the body very slowly. So it is actually associated with the humidity of the environment, and the related symptoms are sluggishness in large areas of the body, especially the lower body and the limbs, phlegm in the throat or the chest areas, blocked or running nose, and mucus. And what is dryness? It is lightweight and can spread fast around the body. So it is the opposite of dampness. The associated season is autumn. And the related symptoms are dryness of skin, upper respiratory tract, okay, eyes, etc., and parts of the body where it is supposed to be moist. Next up, we have heat. Okay, so you all know it means constant higher temperatures than what our human body can withstand for long periods of time. It has a tendency to travel up the body, and it is the opposite of cold. Okay? Associated season is summer, and the related symptoms are heat in the upper torso, okay? Increased circulation of various systems, and inflammation, okay, in various parts of the body, especially the skin. And last but not least, we have the sixth pathogen. This is summer heat. Okay. So it's a term used by the Chinese to describe the short seasons that occurs in late summer before autumn. It is present in the body as a combination, okay, of the heat and the dampness pathogens. So the related symptoms definitely includes both the heat and dampness symptoms as mentioned just now. In general, about 50% of the patients who come and see me experience dampness, heat, or summer heat symptoms due to our Singapore climate and the huge choices of food that we enjoy here. Okay, so let's talk about the internal energies. The first one is qi. Qi is the non-physical energy created from the combination of the air that we breathe, the food that we eat, okay, and our biological parents' internal energies. Okay. It flows everywhere in the body via the channels called meridians, okay, as you can see here, and it controls all the bodily functions. If the qi is not moving smoothly in the meridians, qi stagnation related symptoms will occur. Okay. For example, the tension headache, okay, tension pain, headache, and stomach ache. Okay, and if qi is not sufficient to maintain the smooth flow, qi deficient related symptoms are breathlessness, weakness, and fatigue. Next up, we have blood. Okay, it is the physical fluid made up of many different types of cells that flows in the arteries and veins, as you can see in this image. And its purpose is to nourish all the body organs. If blood is not flowing smoothly in the blood vessels, blood stagnation related symptoms are strains, sprains, joint stiffness, etc. And if blood is not sufficient, okay, to maintain the smooth blood flow, blood deficient related symptoms are lightheadedness, okay, like fainting, okay, weakness, and fatigue. Okay, let's now understand about the yang and yin energies. Okay. So yang energy qualities are similar to the sun, giving us light and warm sensation with the brightness shining outwards. So if there's a deficiency, okay, the symptoms will be getting tired, okay, and falling asleep easily, being afraid of cold, okay, having cold torso and limbs. Meanwhile, the yin energy qualities are similar to the moon, which wanes into the darkness. It's a cool sensation, okay, just like hiding into the shade of the tree from the sun. It's basically the opposite qualities to yang energy. So if there's a deficiency in yin energy, the symptoms expressed by body includes insomnia, okay, hot flushes, night sweat, dry skin or nails or hair, thirsty easily, being afraid of heat, and having warm torso and limbs. Okay. In general, about 20% of my patients are having the qi and the yin deficiencies, but due to similar symptoms with the heat pathogen, okay, most of them are mistaken that they have excess of heat pathogen. So let's now find out how food is digested. The stomach and spleen are the two most important organs for digestion. Okay. So you can see that the stomach and spleen here, stomach digests all the water and food we eat, then transport it to the spleen system, which then transforms the nutrients into body fluids that nourishes the lungs so as to take in the air from the environment to support the generation of our total qi. And the waste body fluids are transported out from kidneys and excreted as urine. Spleen also regulates blood circulation, which transports nutrients to our muscles. And one of the very important function, our immune function, is also affected by how well our spleen functions too. So after knowing about them, okay, here are 3 simple and easy wellness tips good for your digestion, which you can apply at every meal. So the stomach likes to be kept warm and damp. Okay, so do drink fluids regularly, but lesser or no cold water will help to lower the risk of indigestion. Okay? This is because the coldness decreases our metabolism. The body has to warm up the cold water of say like for example 10 degrees, right, to the normal 36 or 37 degrees the body temperature. So if you drink a beverage with a warming quality, okay, for example like ginger tea, okay, when you are taking cold food, for example, okay, then it actually goes well with raw food like salads and sushi. And next point we have chew food at least 20 to 30 times, okay, for every mouthful. Digestive systems in the saliva generated by the spleen system, okay, can actually have more time to excrete it, okay, and be mixed with the food to digest one round before swallowing into the stomach to be digested for a second round. Last but not least, walk or move around after food for 10 to 15 minutes. This is to improve your overall qi flow and easier for the gravity to shift the food from stomach to small intestines. Okay, next up. So how do our emotions affect the digestion? Okay, so the ancient Chinese, okay, understand that qi and emotions are intimately connected. The appearance of physical symptoms are just an expression of the imbalance of the qi and emotions. Okay? So this is the quote from a major TCM classic text, 黄帝内经. Okay? It's a Huangdi's internal classic of medicine. Instead of using much mental and physical energies to focus on extrinsic desires, if one is consistently in states of calmness to tranquility to pure joy, the universal energy will flow smoothly through, and one's life force will be fully focused internally on managing the bodily functions. Okay? So, how can any illness remain or arise as a result? Okay? So, what this means is that if we are able to be mentally mindful of the root cause of any emotion and be able to rebalance it, we will actually be able to heal ourselves and maintain good health. So, what are the main emotions? Okay. They are joy, worry, sadness, fear, and anger. So, all of them affects the qi flow in our bodies. Okay, worry is the main emotion that leads to the stagnation of qi flow and hence decreasing the functions of our stomach and spleen systems. Okay? Those symptoms of excessive worry includes the lack of appetite, okay, bloatedness, burping, yawning, sighing, okay, slow physical reaction times even, okay, insomnia, and pain along the stomach and spleen meridians. Okay? So this is the stomach meridian, okay, and this is the spleen meridian. Okay. So my patients' qi stagnation issues can actually cause them to experience muscle strain on any point along these two meridians, and the pain is resolved when their digestion improves. Okay. So a wellness tip for you is that whenever we are eating, instead of worrying about various issues on our minds, do remember to focus on the joyful experience of taking in your nourishment. Okay? Your qi flow will be much better, and your spleen and stomach will thank you for helping with your food digestion. Okay, so let's move on to the type of food. Okay, Okay, let's continue. Okay, so now that you understand about pathogens, internal energies, and digestion, let's now understand how TCM food is classified. Foods can be either purging or one or more of the 6 pathogens, or nourishing one or more of the 4 internal energies. Okay, so for the purging foods, okay, we have the wind and heat purging, which is peppermint, chrysanthemum, and burdock. Okay. It is not suitable in excess if having cold symptoms. Next up, we have heat purging. So most fruits, melons, okay, coconut, and sugar cane, etc., okay, they are heat purging and not suitable in excess if having cold symptoms. We have the dampness and cold purging. Most spices, ginger, garlic, onion, pepper, and cinnamon, etc., okay, they are not suitable in excess if having heat symptoms. Okay. And there's the dampness and heat purging, green bean, barley, and lemongrass. Okay. They are not suitable in excess if having dryness symptoms. Okay, next up we have the nourishing foods. Tea and blood nourishing, most grains like brown rice, okay, and even Chinese yam, okay, eggs, dates. Okay, these are good for tea and blood nourishing. Not suitable in excess if having tea and blood stagnation symptoms. In nourishing, we have most vegetables, fish, lotus fruit, honey, and American or Canadian ginseng, Xiyangshen. Not suitable in excess if having yang deficiency symptoms. And for yang nourishing, okay, most meats are that cordyceps, eucommia, and walnut. These are not suitable in excess if having yin deficiency symptoms. Okay. Now we find out about stagnation relieving foods. Okay, if you have taken too much meat, actually can take some hawthorn fruit, okay, water. Okay, that means you put the hawthorn slices into water and you can drink it after your meal. Okay, best to be warm water. Okay, this is like good for. So for too much food, we have like citrus fruits. Okay, you can take dried citrus peel, okay, plum, and radish. Okay. And if there's tea stagnation due to negative emotions, okay, some rose, lavender, chamomile tea will help a lot. Okay. So now I'm sure you understand a lot more about how to eat well the TCM way. Okay. So let's go through what you can expect during your TCM consultation with dietary recommendations. So when the patient walks in, I start with my TCM diagnostic template to collect all the relevant data with regards to their main issues to make an informed diagnosis. I help my patients to understand their body constitution so they know why their bodies have the tendency to express the certain groups of symptoms which I mentioned just now. Okay? And a full consultation process with me also includes like personalized TCM dietary recommendation because as explained previously, we are what we eat. So a food chart, okay, is presented to my patients based on their body constitution and explain thoroughly what foods they should avoid and which combination of the foods are currently suitable for them. Okay, so we have now come to the poll questions for today. Are you ready? Okay. So the first question is, okay, what do you think of having a TCM health consultation, okay, included with your annual GP health screening checkup? Okay. Good idea? Okay. Neutral? Bad idea? Okay. Can choose now. So has everyone chosen? Okay, great. Okay, like 79% of you guys, okay, think it's a good idea. 20%, okay, think it's neutral. Okay, and 1% thinks it's a bad idea. Okay, great. Okay, let me continue. Question 2. How many times do you think you need to do TCM treatments for your various symptoms to see significant improvements? Okay. Is it like 1 to 5 times? Okay. Or maybe like 6 to 10? Or more than 10? Okay. So go ahead, please key in your choices. Okay, so we have like 1 to 5 times, like 34%. Okay, 6 to 10 times, like 39%, and more than 10 times, 26%. Okay, so overall it's quite balanced out, yeah? Yeah, very interesting. Okay, let me explain. Okay, actually, right, most people don't know that it doesn't really take many times for your ailments, okay, to be relieved, okay, for 1 to 5 times, right, for these acute pain management issues, okay, and maybe acute respiratory conditions like the flu, colds, and coughs. Okay, so 1 to 5 times is usually enough. Then meanwhile, for 6 to 10 times is usually for long-term indigestion issues like long-term pain management and also skin issues. And the more than 10 times, right, okay, it's definitely for chronic issues like cancer management, high cholesterol, diabetes. Okay, okay, very good. Let's move on. Okay, what type of TCM treatment modalities do you prefer? Okay. So we have, of course, everybody knows acupuncture, herbal formulas, okay, or cupping and or moxibustion, okay, and or scraping, okay, or acupuncture and herbal formulas, okay, or acupuncture and herbal formulas and cupping, okay, or acupuncture and herbal formulas and moxibustion, okay, or acupuncture and herbal formulas and scraping, okay. Of course, the last choice is no preference, okay. So go ahead, choose one. Okay, so we have the results. Okay, let me do this. Okay, acupuncture only. Okay, 5% of you choose. Herbal formulas only. Okay, 14%. Cupping and or moxibustion and or scraping, 12%. Okay, acupuncture and herbal formulas, 25%. Acupuncture and herbal formulas and cupping, 10%. Acupuncture and herbal formulas and moxibustion, 7%. Acupuncture and herbal formulas and scraping, 6%. And then there's a 20% of no preference. Okay, but the highest score is, of course, acupuncture and herbal formulas as expected, okay, at 25%. Okay, great. These are the two most common treatment modalities that you all know and understand, right? Okay, very good. Okay, let's continue. So thank you very much for your time, everyone. Okay, and I believe all of you here have more understanding about TCM food and your health and wellness now. You can see me at this clinic address. Okay, I'm at the Shenton Wellness Center, Alexandra Road. Okay.
Thank you, Physician Ann. Thank you, Shifu. Well, the world of TCM has always been a mystic dimension for me. Well, today with Physician Ann, we sure have learned a great deal. So, ladies and gentlemen, we've come to the time where we're going to do a short Q&A session. And of course, all the questions you'll be getting here will be through you. So, please join me as we welcome back our three lovely presenters in this session. So, we have back Miss Candice Yo, ta-da!
Hi.
Miss Wong Hui Mei, and of course, Physician Ann Tan, whom you all just saw. So, ladies, thank you very much for being back here. We're really very honored to have you to be here. So, we're going to begin with the question one by one. I'll be directing the questions to each and every one of you, okay? Now, the first question is a very good question because I am a consumer myself of this. Now, here's the question, and this is for Candice. Candice, does buying an expensive ergonomic chair make a difference? Expensive means more than $1,000 kind.
Okay, it's a huge investment. Ergonomic chairs nowadays can range about maybe 2,000, can range from the cheap ones to very expensive, like 2,000, 3,000 kind of pricing. So whether it makes a difference or not, it depends again case by case. So for some people, they might find that the amount of support that they derive from that expensive chair really helps to angulate their joint in a certain way or provide the comfort that they need. So they find that it benefits and made a difference in terms of their aches and pains. But on the other hand, I do have a few patients who reported to me in the clinic setting, they felt that they have already invested in a very expensive one. I think it's called Steiner Miller or something. And then so they felt that the pain was still there. So whether or not it is a very case by case kind of a situation, yeah. So exercises, in my own opinion, targeted ones specific to your dysfunction. So getting a therapist to analyze your movement patterns, in my opinion, will be more value adding, I would say.
Actually, ayo, you guys shouldn't ask this. You guys should just ask directly. Candice, what chair do you use personally? Because you know she's the pro. The chair she must use will be good, mama. Right? So what chair do you use? Yeah.
Then you can come to my home and see.
Is it an expensive chair or no? You just have habits that are ingrained in you and remind you to stand and sit whenever possible. You know, check shoulders, relax.
Correct.
That's more helpful than buying a...
Exactly. The latter
I
is
see.
more helpful rather than investing for me, yeah.
There you go. Very, very good advice and very good question as well. All right, next question is going over to Miss Hui Mei. Okay, now Hui Mei, here's the question. What can we do if not overweight, obese? Okay, what can we do if you're not overweight, you're not obese? That means your BMI is normal, but you have high lipid level, LDL, and non-alcoholic fatty liver. Okay, let me repeat one more time. What can you do if you're not overweight, but you have high lipid levels and have fatty liver as well?
Okay, so I mean that looking at the question, right, it looks like it's actually having like high cholesterol and also having this fatty liver issue. So you may, I mean that if let's say for those who are having this problem, you may have to watch your fat intake, the dietary fat intake, especially saturated fat and the dietary cholesterol. So that this saturated fat, right, basically is like those poultry skin, the chicken skin, right? So it's very nice, but it's not good for the cholesterol. And also this saturated fat, right, is the one that the liver will uptake and it will actually store in the liver, and then it causes this fatty liver to happen. Yeah. So and also, I mean, if let's say it doesn't, we don't make changes to the dietary saturated fat, and we didn't cut it down, what happened is that this amount of fat, it will cause further problems like insulin resistance and other issue.